everyone for all the technical errors. তো আশ্বিনের এই কোজাগরি রাতে সবাইকে অবশ্যই শুভেচ্ছা জানাচ্ছি। Myself, Fariha Zareen Pinky, the local officer for external affairs, Dhaka Medical College, local committee, BMSS. So today we will be addressing on the COVID effect on the mental health of people. Psychiatric illness is often deemed to be the curse of the modern civilization. With the pandemic on its full throttle, the impact has never been this much higher. When COVID attacks you, your lung cries for air. But what about your soul? Your soul cries for the support, affection from your loved ones. Conditions like anxiety, post-traumatic stress disorder, depression, mood disorders are actually becoming common during this pandemic, not only for the infected individuals, but also the non-infected ones. Say, for example, the healthcare workers are suffering from post-traumatic stress disorder, approximately 35 to 49 percentile of them. And also there are the people who are homebound. They have to experience like some insomnia, agitation, neuropsychological impairment. So it is a dire necessity to combat the virus as well as the psychological ailment that comes with it. So today in our session, we have our very own Dr. Raisul Islam Parag sir to enlighten us about all of these things. So Parag sir is currently serving as the registrar for Psychiatry Department, Dhaka Medical College Hospital. And we all know about sir. Sir is such a familiar, such friendly, such an amazing person himself, and he's so popular among his students as well as among his patients. And most importantly, sir himself is a COVID frontline fighter. So he definitely has more experience than anyone how to deal with the patients mentally and also physically that are affected. And sir has his own Facebook page. Sir has a huge fan base. Sir is also trained in psychotherapy, counseling. So he was, of course, our go-to-go person at the first place. We are really honored to have sir to grace our session today. And আমি আর কথা না বাড়াই, so let's have a round of applause for sir to grace our session. Sir.
Thank you so much.
Thank you so much, Rebecca. I would like to thank Rebecca and then Faria and Pinky,
Yes, sir.
and the person behind this amazing session. Those who are working behind this, I would like to thank and congratulate everybody that they have taken a great initiative, especially the DMC LC, that is Dhaka Medical College Local Committee, has arranged such a topic, such a initiative, which covered two important topics. One of them was held yesterday by our respected Professor Robidamin sir, who has talked about the physical sequelae or the effects of COVID-19. And today I'm going to discuss about the mental health impact or mental health effect of COVID-19 on the people who are suffering from COVID or who has been suffered from COVID-19 or though has not yet been suffered from COVID-19. So I'd like to share the slide. If anybody can help me, the slide has been given to you.
Yes, for that, someone has to make me co-host. So someone, please make me co-host and then I can share. Because I just gave host to Shamo because of, we were trying to go live. So we're still trying to go live.
Okay,
now I can share my screen, sir. So just
try, no problem. And mental health always has been very stigmatized. And there is a stigma always regarding the mental health, that mental health, the people who are suffering from mental illness are, most of them are aggressive and violent, and most of them cannot communicate with each other. And those who have mental illness are somewhat different from the normal people, and they are not eligible to do any job. They are not eligible to perform any duties and cannot contribute in their families. And they are kind of special seal on their forehead that they are mental patients. These are the stigmas, and there are lack of awareness regarding the mental health. People are not coming to the psychiatrist whenever he or she suffers from a mental illness, and one can have a panic attack, one can have some low mood and some fearfulness, anxiety, or one cannot sleep. But why I'm going to a psychiatrist? That is a question. I'm not a mad person. So this is the lack of awareness throughout the world, and it started since the beginning of psychiatry and since the beginning of medical science. Now I'm going to discuss about the mental health effect of COVID-19 on general population, which is a very important topic. And as soon as WHO has declared the COVID-19 as a pandemic, since in the January, then the mental health issue has come in front, and in the guideline of WHO, as they have published as a guideline for the treatment of COVID-19, they have kept mental health as a prior concentration, and they have made a specific guideline for the physical illness, but physical effects, as well as on the mental effect and the treatment for mental illness due to COVID-19. So let's start. You can see here that the COVID-19 pandemic is turning out to be a major stressor for most of the humanity, and never such an event affected so many individuals all across the globe. And the initial focus is necessarily on the physical consequences of the infection. However, there is recognition that the significant psychological consequences emerging out of the catastrophe need to be addressed. Okay. Can you please go to the next slide? The WHO, which I have mentioned earlier, has warned that the long after the pandemic has been brought under control, healthcare providers will have to deal with the diverse mental health issues affecting populations in different countries. And we have already observing that the number of mental patients in our psychiatry department, in our personal chamber, and all over the country has been, there is a sharp rise in the mental, regarding the number of mental patients. And the mental health issues began emerging almost immediately after the WHO declared COVID-19 a public health emergency in the January 2020, as I have mentioned. Please go to the next slide. The American Medical Association has warned that physicians and the other frontline healthcare professionals are the most vulnerable to develop a psychiatric disorder, as they have to balance between their own duties and that of their own families, and they have to maintain their securities, and they have to maintain their proper hygiene, and as well as they have to take care of their families, and they have to think about a lot of issues like whether they are going to transmit the virus or infect to the family members from their are they carrying the virus from the hospital or the duties or from the duty place. So there are a lot of studies are already have been published that the physicians who are serving as the frontline fighters are suffering from, a significant number of them are suffering from depression and anxiety and stress and insomnia. And in Bangladesh, there are some studies which are still ongoing, and I am still doing a study with the help of my senior teachers and colleagues. The data of that is under analysis now. We have taken about 500 plus data from our COVID frontline fighters. Okay. There are two phases in which there are some mental issues can arise. That is acute phase and the long-term phase. Acute phase is during the outbreak, which is approximately 2 to 6 months. And after the outbreak, there are some disorders which we can call the long-term phase. And in two phase, there are some different psychiatric disorder that can take place. Please proceed. In acute phase, the main issues to be dealt with include immediate mental health impacts such as fear, denial, and some anxiety, some worries, and some dissociative symptoms. Most interestingly, there is a conversion-like symptoms. Conversion disorder, you all know that there are so many symptoms in conversion disorder. There is a motor symptoms, sensory symptoms, and mixed symptoms, and that are seen in the conversion disorder. And dissociative symptoms means there may be some amnesia, there may be some fugue that is going to a long distance, but he cannot recall that I am going to a long distance. I have gone to a long distance and did some job there, but I cannot recall. These are the dissociative features. And suddenly I cannot recall my memories. I do not know. I cannot recognize my father. I just misreading my father, misreading my parents, misreading my wife. These are the dissociative features due to the internal conflicts that can appear in the acute phase. And most importantly, there is substance withdrawal and substance intoxication that can occur in the acute phase. The persons who are having substances can be very dangerous, as their supply of substances can be interrupted, the supply can be shortened, and the supply can be seized. So there can be an acute withdrawal. And those who are on the substance, there are so many people who have increased their use of substance, and they can have a toxic effect. And during the outbreak, so these are the features that can take in an acute phase. And can you please proceed to the next slide? So now, if we discuss about the long-term difficulties that a person can have after a COVID outbreak, first of all, I would like to say there may be a chance of depression. Any disease, any organic disease which have a long duration, which have a potential effect on physical health, that can cause secondary depression. Any chronic disease or any severe physical illness can cause secondary depression. COVID itself can cause secondary depression, and any kind of viral disease can cause post-viral depression, can cause post-viral viral fatigue, or even the psychotic feature may come. And there may be increased substance use that I have discussed earlier, and the pre-existing mental illness can flare up in the chronic phase or long-term phase. Especially PTSD and somatisation disorders are very much important here to discuss. And you all know what is PTSD. There must have an extraordinary stressors to develop stress disorder. We can divide the stress disorder into two categories. For the undergraduate students, we can say the two categories only. There is number one is acute stress disorder, and the number two is post-traumatic stress disorder. Acute means after someone has been exposed to an extraordinary stressor, like watching the death of some person falling from height, like watching the death of near ones, like being in the ICU, being in the ventilation support in the ICU, and watching so many deaths around in the nearby beds. These are the extraordinary stressors that a COVID infected person can have, and these stressors, we call it extraordinary stressors. And within 1 month, the symptoms that develop regarding the stress, we call it acute stress disorder. And in acute stress disorder, there are some startle phenomena, and there are some recurrent flashback, and there are some avoidance, there are some nightmares, and avoidance of the memory. And these are the features of stress disorder. And if these occur within 1 month, then we call it acute stress disorder. And if this occurs after 1 month, then we call it post-traumatic stress disorder. And then comes who are the most vulnerable population to develop a mental disorder or mental problem in the COVID situation. At first, I must have to mention the children. Children are very much sensitive identity. They have their own identity, but sometimes we just forgot We just forget that they have their identity, and we just think them as our asset, and we just want to direct them as we want to, and we sometimes do not evaluate their emotion, do not evaluate their demands, their needs, and they can have their own opinion, they can have they have their own choice, but sometimes we overlook that. These in general can cause depression, can cause irritability, can cause central behavior to the children, and especially in the COVID situation, where the schools are closed and they have been separated from their friends. They have no chance to go around and hang around and have some time in the food shops or in the fast food shops, and no chance to go to the parks or no chance to go to outside. So they are more, and as well as they cannot express their emotions as the adults can. So they are the most vulnerable group, those who can develop some mental illness in COVID situation. And then senior citizens who are already in the risk of having the severe complication if they are infected with COVID, with coronavirus. So they know it, and they are hearing it and watching the news, and they are sometimes they are overburdened with the news, and they know that they are the high risk people, and if they are infected, they are going to have some great problem that going, and they can be hospitalized. So these thoughts can worry themselves. These thoughts can make them in a position from which they feel very uncomfortable. And these are the, so senior citizens are always, and they have they just they most of them have retired from their job, from their business, from their work, and they spend their most of the time by going to the tea shop, by going to the mosque, and by going to the any kind of prayer, and going to the relatives house. All these, when all these have been stopped, and more, and on the top of this, there is a chance of infection, there is some uncertainties, and all these make them very much anxious and fearful. And pregnant women who are already who are always been vulnerable to develop any kind of anxiety or depression in the normal situation. In different studies, it has been found that about 10 to 16% women with pregnancy are can develop anxiety or depression in general situation. But different studies in this pandemic period, the limited number of studies have been published, it has found that around 50 to 60% of pregnant women have developed some stress related features, or some anxiety or depression or other mental problems in the pandemic situation. So pregnant women are already vulnerable, they are immunosuppressive sometimes. So it's very much it will be very much fatal, and it becomes very much fatal for them if they develop any kind of mental disorder. And especially, and if they are infected with COVID-19, they must be handled with a lot of care, both physical care and mental care. And those who are homeless, of course, those who are lacking the social support and lacking the economic support are always been in the vulnerability list of developing mental disorder. In the COVID situation, they are already in the vulnerable group. And life-threatening chronic medical conditions like cancer, chronic renal failure, liver diseases, and those who have asthma, COPD, immunocompromised patients are most vulnerable population to develop any physical condition, physical hazard, and to develop any mental condition, mental disorder. History of the severe mental illness, those who have the history of severe mental illness. And which are the severe mental illness? For the medical students here in this group, I should make it easier. I should go to easier approach. Psychosis. Those who are having psychosis, we call it major mental illness or severe mental illness. Severe mental illness has some criteria like hallucination, like delusion, like the disorganized behavior, like the abnormal talk and irrelevant speech and disorganized behavior and negative symptoms. This all goes into the criteria of severe mental illness. So there is every chance of flaring up of severe mental illness in this COVID situation. Bipolar disorder and psychosis that can be flared up. Okay, can you please go to the next slide? And there are some unique features of individuals affected with psychological stress. And what are the features of psychological stress? It's very important to know, especially the medical students who always undergo some stressful environments. There are a lot of exams, though, especially the symptoms of stress is very much important, and for general population as well as for population who are suffering from COVID or who are in a fearful situation of this pandemic. The overlapping, there is some overlapping, like those who have depression have anxiety features very frequently. There is a depression and anxiety overlaps most of the time. You have to keep in mind that. And for example, there is an example here. Anxious people may take some substance, may take some alcohol due to relieve their anxiety. Sometimes they can take it, and vice versa. The alcohol and substance can cause depression in case of chronic use. And a vast majority of people presenting with disaster-related psychological disturbance, which I have mentioned earlier. That is post-traumatic stress disorder, and any kind of stress disorder is very much common in this situation like COVID-19 pandemic. Okay, please proceed. And what are the common stressors people face in this situation? Number one, the rising death toll in various parts of the world is creating a sense of panic. There are a lot of news regarding the death. So many number of people are dying in the country and in the abroad. We have so many relatives in our in abroad, and we have so many people who are suffering in the hospital, and so many people are passing away, which creates a lot of fear and creates a lot of anxiety among the population. And the survival guilt is very much important. Those who have been who are the survivors or who are suffering from COVID-19, they have the guilt that I have spread the virus to here and there. I can I can spread it to my near ones. This is the common fear. Even who have not been tested for COVID-19 and who have no symptoms, but whenever one hears that one can carry the virus and one can transmit the virus without having any symptom, they can have a lot of anxiety that I have no symptom, but I don't know if I have transmitted the virus to my parents, to my children, or to my partner. This is the fear, which is sometimes natural, and if the fear is very much persistent, pervasive, and very much intense, and due to this fear, if one is avoiding the situation, avoiding any kind of outdoor activities, even when a patient come to my chamber who is avoiding all his job interview, he has been called for job interview, but he is avoiding the interviews because there is chance of being infected by the coronavirus. So when this goes to such an extreme level, then we call it abnormal, and then we try to diagnose it as a case of phobia, or as a case of anxiety or depression, or like that. So you must have to remember that what is normal and when to diagnose a disorder and what is normal. So where there is a certain uncertainty, there must be some sort of anxiety, some sort of stress, and some sort of panic. But when it will cause impairment in your personal, in your social, in your occupational, and all domain, then you have to call it a disorder. So we are telling about the mental health impact. Let us come back to the slide. And the prospect of losing employment, and there is cut down of the source of income, there is stopping of the business, and there is loss in the business. And so many people are leaving the Dhaka city and leaving the main town and going to their own hometown. They have lost their job and they cannot pay their installments in the bank. So all these are the common stressors that can act as a precipitating factor to develop any kind of mental illness. Can you please proceed now? And there are so many other factors, like not being able to place food on the table daily. And there, people are now overburdened with the misinformation about the coronavirus, especially on the social media. And even the WHO has guided us in this way that you should avoid all the junk news, and you must have to watch the authentic news, like the WHO website, like your country's national website. And you can limit the hours of watching news by half an hour, not more than that. If you are there is overabundance of news, then it can create a lot of stress on your mind. And social distancing has been very much stressful, especially for the young and adolescent. I have mentioned it earlier. And inability to buy the groceries, like the daily foods and meats, etc., are always a stressful thing and daily hassles. Okay, can you please proceed now? And now we are going to discuss the common psychological disturbances. First of all, due to significant life change, there may develop some symptoms like sadness of mood. There is most of the time of the day, and for at least 14 days, there may be a feeling of depression. There may be a feeling of sadness. There is a low feeling. And one can have low feeling if there is a bad news or sad news. But if it is persistent, if it is predominant, and if it is pervasive, and wherever you go, whatever you do, everything seems to be not like before. Everything seems to be very much annoying. Everything is not you are not enjoying anything at all. That is the symptom of depression. That is the sadness of mood. And then we call it the sadness of mood, or low mood, or depressed mood. Persistent preoccupation with illness worry is a very common thing. I think most of the people have that I can be infected, or if I have infected, then where should I go to take the treatment? What is waiting for me? What is waiting for my parents? What is waiting for my senior citizens in my family? This is normal. This is not abnormal. Every time, whenever it causes the functional impairment, then we cause it the disorder. So we are discussing here about the symptoms. The symptoms is different from the disorder. You must have to remember that disorder, we have to call it disorder when there is impairment. And there may be inability to cope, and there may be some degree of dysfunction as well. Okay, please proceed to the next slide. Okay, there sleep and appetite disturbance is very common thing. Most of the students, especially those who are who are doing the classes in online, there is no specific schedule in the class. No specific class schedule, and no specific time for going to the college, medical college, and no specific time schedule for going to the school. So they are rising up very late in the morning, and they are having their breakfast in about 12 or 1 p.m. and eventually all the meals have been a bit later, and sleep pattern and appetite has been changed in this pandemic. And there are so many guardians who are coming to us with the complaints that my kid is not in the previous routine. All the routines have been disrupted. That's why we always, from the beginning, we always talking about maintaining a strict routine, about the children's. The routine will not comprise of when you will study the history, when you will study the chemistry, when you will study the science. This is not the routine. We are telling about the routine of sleep. We are telling about the routine of taking meal. We are telling about the routine of taking the shower in time. These we have to maintain this timing. Otherwise, everything will be disrupted. And the child, when the school will be open, the child or adolescent will develop school refusal. He or she will not want to go to school, will start crying whenever he will in front of the school or college, will develop very low and sad mood whenever he or she will go to the college. Okay. Then there is a reduction of activity or feeling very restless, and there is low attention, concentration, and there may be fatigue and loss of self-esteem and self-confidence is very important, as all the routine has been disrupted and all the functioning abilities have been postponed or stopped. And this is enough for destroying destroying all kind of confidence in a person. Okay, please proceed. There is worthless ideas which will come in mind, and there will be feeling of helplessness there. And whenever it is very much intense, and whenever there is a lot of agony, a lot of depression, in there may be death wishes that can come in the end. And sometimes some may have the passive suicidal thought, like if I die in the morning, if I will not awake in the morning and there will be a painless death for me, it will be good for me. As there is a religious barrier to commit suicide, so some people cannot think about the suicide actively, rather they are thinking in a passive way. If there is a painless death, that will be a good solution for me. So suicidal thought is very important, which is coming in the mind in the pandemic situation. And about the substance, I have talked earlier. There may be substance withdrawal and there may be substance dependence. Both are taking place in this pandemic. Those who are jobless, those who are spending the very much leisure time in their home, they have nothing to do and nothing recreational is there. Then somebody takes the opportunity to take some drugs to have a good move on his or her mind, which is which we call the maladaptive coping strategy. Or someone has lost his job, or someone has lost his business, or there is a massive failure in his business or in any sector. Then he tries to cope up the stress with taking some alcohol, with taking some marijuana. All these are maladaptive coping behavior. So those who are vulnerable, those who are very much prone to develop anxiety, and those who have very less coping strategy from the beginning, are vulnerable to develop this kind of substance use disorder or any kind of mental disorder. So please proceed. That has been told earlier, that it can cause dependence or addiction. Continued use can cause dependence or addiction. Okay, please proceed. And let's talk about the other mental health problems that one should keep in mind in this pandemic. That is the anxiety features. We all know that anxiety is very important. Anxiety, the features or symptoms of anxiety are very important for a medical student, because these questions come in the papers, in the professional examination. So let us have a short discussion about the anxiety features. Anxiety has two types of features. One is somatic symptoms and one is psychological symptoms. Among the psychological symptoms, the feature of anxiety is, number one, inability to concentrate. There are a lot of worries that is coming into the mind, and one cannot stop the worries. And that is, we call it sometimes free floating anxiety. That a lot of thing is coming into the mind, a lot of bad apprehension. There's something sinister, something bad can happen. This type of worrying thoughts can always hammer on your head or on your mind. These are the key features of anxiety disorders, and especially the psychological features we are talking about. And then one have the reduced concentration. One can have a poor anger control. One can have the irritability to noise, and fear of death and fear of impending doom. And these are the psychological features of anxiety. And among the somatic symptoms or bodily symptoms of anxiety, there is palpitation, there is dizziness in the head, there is headache, there is headache in the occipital region, there is stiffness in the neck, there may be pain in the back, there may be butterfly in the stomach, and there may be nausea, and there may be dry mouth, there may be loose stool, and there may be erectile dysfunction as well, and insomnia. These all are the physical symptoms of anxiety. And one can have panic disorder as well. In case of generalized anxiety, the symptoms which I have discussed earlier, that is very much persistent, and all over the time one is having some sort of anxiety. This is generalized anxiety disorder in short. And in panic disorder, there is an abrupt surge of intense fear which reaches to the peak in about minutes, and which persists about 15 to 20 or 30 minutes maximum, and then it goes to the normal level. And when it reaches to peak, and it is so severe and it is so life-threatening sometimes to the patients, that I'm going to have a heart attack, I'm going to die this time, and he or she just run to the emergency department or run to the cardiology department. Am I going to have a massive, am I having a massive heart attack now? The symptoms are sudden restlessness, sudden palpitation, sudden cramping of abdomen, sudden tremor and sweating, chest pain, chest tightness, and the shortness of breath, which reaches peak within minutes. These are the differentiating points from panic disorder and from generalized anxiety disorder. So generalized anxiety disorder is a bit persistent, and always there is a worry. And panic is episodic and intense fear of death, which reaches peak within minutes, and it goes to the normal level within 30 to 40 minutes or within hours. Okay, please proceed. Then phobias. We all know that phobia has two components: fear and avoidance. One is fear is not an abnormal thing. Everybody fears about a specific thing. But if one constantly avoids the thing, and the level of avoidance is causing impairment in your social life, in your personal life, then we call it phobia. Then I mentioned a case about a patient in my chamber who is avoiding all his job interview due to the fear of being contaminated with coronavirus. So this goes to the phobic level. This goes to the level, abnormal level, and we call it is suffering from specific phobia. Or there are some obsessive compulsive disorder, obsessive compulsive features which are very common now, which will come into the slide in the later phase. Can you please proceed? We can see the obsessive compulsive. Yes, it is obsessive compulsive disorder. You all know that obsessive compulsive disorder has two components. The disorder, the name tells us that it has two components. Number one, obsession, and number two is compulsion. Obsession is repeated and intrusive and unwanted thought, image, or action. That is, I know that there is, my hand is cleaned up properly, but a doubt in my mind that if there is any kind of germ, if there is any kind of dirt, I know this is unnecessary, and this is totally, it has no base, that I have just cleared it up. But I know, but I cannot control my worries. I have to wash it again. I have to whip it again, and I have to check it again sometimes. And these are the compulsions. That is the act or rituals that comes in response to obsessive thoughts, in response to obsession. That is that is called compulsion. For example, I am having a doubt that there is some germ continuously and repeated way, and which is I know that it is irrational. Still having the doubt, that is the obsession. And due to this doubt, I am just repeatedly washing my hands. That will be called as compulsion. So this OCD has a sharp rise in this pandemic. Those who have pre-existing OCD has been flared up, and those who did not have OCD has come to us, are coming to us with the features of OCD. So these all are the effect of pandemic since the January of this year. And as the days goes on, the severity of illnesses are increasing, and the number of cases due to the pandemic, whether directly or indirectly, the pandemic is acting as a factor to develop the disease. Can you please proceed? We have discussed this earlier. These are the common symptoms of severe mental illness. That is the psychotic illness. In there will be a suspiciousness or delusion. There may be hearing of voices that we call hallucination. There may be false belief, poor self-care. These are all the common symptoms of severe mental illness. Please proceed. Then we want to talk some. I think we are running short of time, and we have to. We are going to talk about some. These are the problems, but we have to tell about the solutions. We have to tell about the treatments and what we should do in this situation. These, I think, it should come in discussion. First of all, to stay positive, what things you have to do? Number one, not following the daily news too closely, and leave the unnecessary news, and leave the groups, leave from too many social media groups that shares irrational news, that share some news that is overburdened and over information and misinformation is there. Just leave the group. And number two, getting away from social media, that I'm telling about, is a good way to prevent the getting depressed. Catch up on the domestic work. You just help your mother, you just help your partner, and that is, you have to be physically active. And whenever you are active physically, there is a neurotransmitter. You all know that dopamine is released in your brain, which will give you pleasure, and there will be a release of endorphin when you are physically active, and it will give you immense pleasure, as well as physical activity can boost your immunity as well. And most importantly, when you are stress-free, and you are going to have a good immune system, and whenever you are stressed, your immunity system will collapse. And there is a special branch of study, there is a special science. We all know that neuroimmunopsychiatry, there is a close relationship between the psychiatry, between the stress and the immune system. You can read different kinds of books, and you can take up a new hobby, or you just follow your previous hobby. These are all the alternative ways that you can take on to cope up the situation, to stay positive. There are some more points. Can you please proceed? I think you are already practicing these. Listen to your favorite music and communicate with your closer ones, communicate with your older friends that you have lost earlier, and there start chatting with your old friends that you can start it again, and pray together, laugh together, work together, and eat together to bring your family closer together. And this is the high time to be reunited with your family, to rebond, to repair the bondings within your family members that has been a bit weak in the earlier days, and share and amplify the positive stories, and always think about your past achievements, think about your past glorious days. And auto suggestion, we all say that always suggest yourself automatically and think about the achievements that will boost you up and that will help you to stay stress-free. So these are the coping strategies. Try upskilling, whether you are a techie or in other profession, what may be your profession. Try to develop your skill. And you are a worker, then you just worker in a road. You just try to improve your skill. You just think how you can improve your skill, how you can develop your business after the pandemic has gone, how you can set up in an alternative setting in this situation, how you can work from home, and you can think everything that will give you a force to go forward. And practice the deep breathing exercise or relaxation exercise. Sometimes it's very difficult to do of your own, from your own, but you can take help from YouTube, you can take help from any psychologist or psychiatrist, you can take help from us. And watch the comedy shows, and watch the dramas, watch the movies, and these are all a lot of, it has been discussed a lot of times earlier. You all know all these, I think. And be supportive to others and those who are struggling with mental health issues. And there is a term, altruism. You all know that altruism, that is giving or helping someone or supporting someone without unconditionally, without any expectation of having any return. That is called altruism. Just help help a people, help a person who is not getting money, who is not getting the food, help a pet, help a street dog, help a street cat who is not taking the food. These all can cheer up your mind. These all can bring a sense in your mind that you are contributing in your family, in your community, in your society. And this can play a very vital role in decreasing the stress and in removing the stress, and will give you a positive vibe to move on. Okay, so these are all about, I think, to discuss today. Is there anything left in the upcoming slide?
Yes,
I think, is there any more slides? No, I think we are going to the end. There may be another slide which will show you the thank you slide, and I want to end up this presentation with this slide. And the summary is, there are a lot of problems here, but whenever there is a problem, there is a solution as well. I have just tried to give the key to the solutions, key to the problems, solutions in a very short way. But if you need any kind of help, any kind of practical help, you can come to us. We are very much ready to help any of you. So thank you very much. Thank you for giving me the opportunity to present here. And I really feel honored and pleasure to be here.
Thank you so much, sir, for such an enlightening, and you also not only cased about the common symptoms that we were facing, but also taught us how to differentiate between symptoms and what is a disorder. So I think I will share something personal. For example, today we had this huge crisis going on, and then when you came to the page about being positive, take a long breath, then only we realized among all chaos, we can find a calmness by remembering how to breathe. So thank you so much for such an elaborate discussion. And now I think I'll ask Pinky to go on with the questions in a few bit, but before that, so I would want to notify that we are live now on Facebook, so all the question answers will be viewed live on the BMSS page finally. And also who have not been able to see the entire session, we will be broadcasting it live later as a recorded video. So Pinky, please proceed with the questions.
Okay, thank you so much, Rebecca, and thank you so much, sir, for this informative session. Actually, we all need altruism. Okay, so I'm moving on to our question answer session. I'd like to request the participants who wants to ask sir a question. You may raise your hand there's an option in the Zoom so that Fariha Choudhury or anyone, our host, can unmute you and you can ask the question yourself. Okay, so there's an opportunity for you to ask the question directly to sir. And in the meanwhile, I am reading aloud the questions that we have got already in our chat box. Okay, so many thank you messages, sir. Thank you so much, sir. Thank you so much for explaining the mental health problems so clearly and practically. Thank you so much, sir, for an informative session. Wonderful webinar. Everyone is praising you, sir. Okay, so there's a question from Deepak. He said, sir, what do you think is the difference in mental health of people before and during this time of quarantine?
There is a huge difference. There is a sharp rise of anxiety, depression, and any kind of mental disorder after the pandemic. And there are some studies in the which I can remember in America or USA. There is about 274% rise of the cases of depression in April 2020 in comparison to January 2020. So that will this single data will help you to understand the mental health has been disrupted, and there is a sharp rise of mental disorder or mental problems after the pandemic. And people are anxious, people are nervous, and people sometimes become restless, and they are having grief. Most importantly, most of us have lost near ones somehow by COVID-19, and grief is a long-lasting phenomena, and it comes like a wave, and it never ends. And all over the world, in a whole, the mental health situation has worsened so much.
Okay, sir. Moving on to our next question. Narmata Ravindran. She has asked, good evening, sir. Can you please explain about the rise of domestic violence in households all around the world during pandemics such as this?
Yes, a very important question. There are so many studies throughout the world, and I cannot remember the numerical values in Bangladesh. There is one study that has been performed. The domestic violence has a sharp rise, undoubtedly, like the other mental problems, as there is nowhere to go. There is no place to enjoy, no place to go, and there is a financial loss, and whenever everyone is busy, we just overlook the faults or errors in our partners. And whenever we are most of the time we are locked down in our home, we are working from home, then some errors are sometimes visible more than the past time. And when we just talk about the errors, everyone is irritated right now, and I think it's for the last 8 months, everyone is anxious and irritated, and simple words can irritate nowadays us. So whenever we talk about the faults, or whenever we talk about the errors in our partners, and the situation suddenly goes beyond the control, and there is some hot talk, and which eventually sometimes converted into the domestic violence. And domestic violence includes not only the physical violence, it includes the emotional violence, it includes the sexual violence, and everything. So there is a sharp rise of domestic violence overall throughout the world and in the Bangladesh.
Okay, sir. So, sir, Mehdi Hassan has asked that what is the most vulnerable age group for mental health disorders, specifically in COVID-19 period?
I have mentioned that
Yes.
specifically age group is very difficult to mention. That there are some vulnerable groups like children, like elder citizens, and some children with special needs, like children having intellectual disability or autism spectrum disorder, who cannot express themselves properly. They are most vulnerable, and the pregnant women, and these are the groups, I think I should say it, the groups who are most vulnerable to develop mental illness. The age group is very difficult to categorize this way, rather than we call it the groups.
Yes, sir. Sir, Janisa Chetri, she has asked, good evening, sir. Would you be able to highlight on the mental effects of the pandemic and lockdown on pregnant women, the anxiety related to hospital visits, delivery, breastfeeding?
Right. I have just mentioned in my presentation that the worldwide, there are some studies, a lot of studies. The result shows that about 10 to 16% of women who are pregnant can develop any kind of mental illness, especially before the delivery. There are some repeated thoughts and worries and anxiety and stress, and after delivery there will be depression, which is very normal sometimes, and there may be some postpartum depression, there may be some postpartum psychosis. This all can occur. But during this pandemic, so for the studies, I have gone through the studies, there is 50 to 60% affected pregnant women in this pandemic situation, affected by anxiety, affected by the depression or any kind of mental disorder. So one must have to assure them that you are under the doctor, you are under the supervision of a doctor. One can have a video consultation with the doctor, and one can reassure her that everything is all right. And social and emotional support is very much important. We all know that pregnant women needs a very much extra emotional effort, extra emotional care, and extra social care, and extra companion, which has been cut down in case of in this pandemic. And she is not going to the relatives home. She is locked down in one room, in her room, in her own home, but she's not allowed to go outside. This all can precipitate mental illness. So main thing is increase the emotional attachment, and increase the emotional touch, and increase the company with her, and reassure that everything is going fine. You are under supervision of a doctor. This all can calm down a pregnant patient, and this is all can save a pregnant woman from developing any kind of mental illness.
Sir, thank you. There's an appreciation for you, sir. Ashfia Mir Ahuna said, greetings, sir. It's been an honor to hear you. I have been dealing with so much difficulties post-COVID, and hearing you today is a sigh of relief. Glad that I could be a part of this session.
Thank you so much.
Okay.
I think we should move forward with calling forward the participants.
If anyone wants to ask question directly to sir,
you can unmute yourself or turn on your video to do so. So I feel like it will be more interactive. And thank you again, sir, for answering all those questions. And like always, sir, it is only right why people are like fan basing you, and how calming and how down to earth your answers and you are. So thank you so much for being with us here today again, despite all the chaos there is.
Thank you so much. Thank you so much. I am very much proud that this brilliant and young people, young medical students are doing an excellent job by hosting this kind of events, which are very much helpful for the general people and for the medical students. And I'm very much inspired, and I'm very much hopeful that this country is going to have some brilliant doctors as well as some good humans, and which will make a definite change in our health system. And you will make us proud in a very short time, I think. My blessings and my prayers for you.
Thank you so much, sir, for such warm wishes. Now I'm waiting for participants to raise their hands, please, so that we can proceed. Okay, Janissa, please unmute yourself.
Assalamu alaikum, sir.
Walaikum
Sir,
assalam.
I am Janisa from Batansa. I had a question, sir. So as you can see right now, with the fact that most of us are out of university because universities are closed and some are having work from home situation, and we have a lot of free time in hand. And in such situations, people who have pre-existing mental health issues like depression and anxiety, we have a habit of binge eating, as it's commonly said. It's binge eating, but we also have medically, we say bulimia nervosa, right? So for people who have these kind of problems, I think situation like this favors them to eat more, and they keep worsening this habit of theirs. So if there's any practical solution or like practical way of tackling all this, if you could explain.
The question is, those who are having bulimia nervosa or binge eating disorder, what will be the solution for them, right?
Yes, sir. Like how to not worsen it in such situations.
Yes, yes. First of all, try to involve them in other activities that are available in the best possible alternatives. You have to involve them. You can buy a treadmill for them. You can buy some new devices for them. You can buy some new books for them. You can employ them in a new work, or you can buy some new flowering plants for them. Just engage them and just encourage them to do the works. And about the foods, always try to prepare the healthy foods. Always try to prepare the green and leafy vegetables, and try to avoid the junk foods, and try to avoid preparing the foods that are containing high in carbohydrates. There is no chance for the patients for binge eating, and if they have eaten, they will eat the leafy vegetables and other that will not, I think, cause more harm to them. And these are the alternative options for them, I think. And a video consultation with a doctor, or with her or with his psychiatrist, and continuous follow-up is very much important. Other than this, otherwise, there will not be a complete treatment for them or complete solution for them.
Thank you so much for answering that question, sir. You gave very practical solutions that I think we can all apply in our lives, not just for the patients, but for ourselves as well.
Thank you, Janissa,
Thank
for the
you,
question. Now, anyone else?
Assalamu alaikum, sir. So I'm
Walaikum assalam.
Shamail from Kashmir.
Welcome.
Sir, my question to you is that, sir, a lot of us have obsessive thoughts and obsessive compulsive disorder, and like nowadays it seems like our obsessive thoughts and obsessive actions are like becoming more and more like prominent. Like initially maybe it was under control, but during the pandemic it has increased, and the number and times of like the excessive thoughts leading to insomnia, anxiety has increased. So what is it that we can do to keep all of this under check?
Very interesting question and very important question. So many patients with OCD has come to us in this situation and requesting that, and their guardians are requesting us that please don't treat so aggressively. Little obsession is very good in this situation. So we have to just keep a close eye to the patient, that her problems or his problems are within the normal limit, or it is going to a very abnormal situation, and that is very much time consuming. How much time consuming it is very important to us. We have a scale measuring the to measure the severity of the OCD. Then after scoring, we decide, what measures should I do. Practically, we tell the patients to apply some behavioral techniques to get rid of obsessions and to control the obsessions or compulsions. Like there are so many techniques which are very difficult to explain now in a short time, like thought satiation, thought stopping. There are some thought distraction, and there is some mental arithmetic procedure to stop the thoughts or to distract oneself from unnecessary thoughts. We just advise them to apply those, and we just advise the guardians to apply those on the patients. And these are the measures we usually apply to the patients.
Thank you, sir.
Thank you, Shamail, for the question. Now I think we'll be taking a few more questions and then we'll wrap it up. So anyone?
Shamal also asked one question previously, that how is the mental health of patients during hospital stay being taken care of?
Very important question. As I have observed it practically, I have the chance. Had the chance to do COVID duty in the COVID hospital DMCH2, and the patients I have come across, they have some physical symptoms, but they have more symptoms, more mental symptoms or psychological symptoms, which I think which has suppressed the physical symptoms sometimes. Some are having panic attacks, some are having increased worries that my saturation is going down, please check doctor, I'm feeling, some have psychogenic breathlessness, some are having shortness of breath, but the saturation is perfectly all right. These are all of the psychological problems that are complaining, the patients are complaining, and we have to handle it immediately. And as I'm a psychiatrist, I have handled them with a lot of time, and with all my experience, with all my knowledge and my skills. And not only me, all the doctors who are doing duties and who are doing the doing duties in the hospital in high risk areas, they are trying their best to calm down the people, to settle the patients physically and mentally. So everything, whenever you assure one patient that you are absolutely all right, your pressure is all right, your D-dimer is all right, your blood is not getting thick, and your lung is functioning very well, hope you will be all right. Just simple, these simple words can stimulate a patient. These simple words can instill some hope in the patient, which can give a better feeling in the patient, I think.
Yes, so well said, sir. So I had a question actually. So like so many people were coming forward saying that they had never been accustomed to seeing so many deaths in their lives. So many people were COVID positive in their family and they were losing so many loved ones. So sir, how would you suggest to counsel them? Like, you know, even though you can't say that we understand, because I don't think anyone can say that I understand when the other person's family member or loved ones are dying. So how do you suggest that we should deal with situations like that?
It's a very sensitive issue, and we have to handle it in a very much sophisticated way. There are some words that cannot be used when some person have lost their close ones. Like, okay, we can discuss it later, but you have to be empathic to them. You all know the difference between the sympathy and empathy. Sympathy means that you are showing some your body language and some gestures and postures, and so your words will say that you are beside him or her. And empathy means putting other shoes into your own foot, which is very much important in this case. So what if you would feel, what if you have lost your parents? Can you have you ever thought in this way? Whenever you will start thinking this way, if I lost my parent, then how will I feel? Whenever this thinking has come into your mind, only then you can handle, or you can counsel, or you can have a conversation, a better conversation, a good conversation, or you can condole your friends or in the people in front of you who have lost lost his or her closer ones. There are some words or some sentence that should not be used. I can say it in Bangla, যা হয়েছে ভালোর জন্যই হয়েছে। তারপরে হচ্ছে যে বেশ কিছু এরকম কথা আছে যেগুলো আসলে আমার মনে হয় না যে একজন যে আত্মীয় স্বজনকে হারিয়েছেন যেগুলো তাকে বলা উচিত। তো simple silence, sometimes simple silence, a little hug, and just put your hands on your friend's shoulder, on the person's shoulder, can speak a lot more things than যা হয়েছে ভালো হয়েছে। So you have to practice it, and you have to be sensible, and most importantly, you have to be empathic whenever you are talking a person who has lost his close one.
That's right, sir.
Thank you so
Yes,
much,
sir.
sir.
Sadia Nusrat Remit, she has asked, Assalamu alaikum, sir. Sir, can you please tell us about mental health issues of underprivileged people who are not aware of psychiatrists? They're also facing the pandemic and its consequences, but aren't aware of the help they can reach out to.
Sorry, I cannot hear. There is
Okay,
some
sir.
interruption in the network, I think.
Okay, sir.
Underprivileged people?
Who are not aware of psychiatrists. So can you please tell us about the mental health issues of these people?
Underprivileged people?
Yes, sir. Sir, underprivileged people, their mental health এর যে অ্যাওয়ারনেস, মানে সেক্ষেত্রে তারা আসলে কি করতে পারে, কারণ তারা তো সাইকিয়াট্রিস্টদেরকে চিনেও না বা তাদের কাছে রিচ আউট করতে পারে না।
এক্ষেত্রে যেটা হচ্ছে যে সোসাইটিতে অন্য যারা আছে তাদেরকে আসলে এগিয়ে আসতে হবে অনেক বেশি, যে তাদেরকে হেল্প করার জন্য। এটা খুব ইম্পর্টেন্ট। হ্যাঁ, কারণ হচ্ছে যে তাদের যে ইস্যুস গুলো অ্যাড্রেস করার মতো অবস্থাও কিন্তু অন্যদের দায়িত্ব নিতে হবে আসলে, যে তাদের যে কিছু প্রবলেম হচ্ছে সেগুলো অ্যাড্রেসটা করবে কে? অ্যাড্রেসটা কিন্তু অন্যদেরকেই আসলে বেশি করতে হবে। তো যত বেশি, ওই যে বললাম, অল্ট্রুইজমের চর্চা যত বেশি হবে, তত বেশি আমার মনে হয় ওভারঅল মেন্টাল হেলথ ভালোর দিকে যাবে।
Yes, sir. Thank you, sir.
And still we are hopeful. We are hopeful that there are so many organizations who are working tremendously with the underprivileged people. There are so many NGOs, so many private organizations, and so many government, a few number of government organizations as well, who are doing a great job regarding the underprivileged people.
Okay, sir. So, sir, Priya Odhikari, she said, good evening, sir. How do we medical students prepare ourselves mentally before we start to attend our clinical classes, since now living with the virus seems to be the new normal?
Very good question and practical question. First of all, gather proper knowledge about the virus, how it is transmitted, how one can be contaminated, how one can be infected, and how one can save herself or one can have good defense or good protection against this virus. When you have the proper knowledge, you will have 50% reduction in your anxiety or in your stress. When you know how to wear a PPE, how to put off your PPE or PPE gown, how to clean your hands, how to wear a goggles, and how to protect yourself properly, then you will, I think, be relieved a lot. This is the first thing. And then use proper PPE. Take your hand sanitizer. Always take extra hand sanitizer in your pocket, and do the mask, wear the mask properly. It is better to wear a good quality N95 for the healthcare professionals, and only mask cannot help you, cannot protect you, I think. And WHO says like that, when you use the mask as well as you wash your hands properly, you disinfect your hands frequently, and always you have to be, it's like OCD patients, like OCD patients in the normal scenario, not in COVID situation. What a OCD patient does actually, just he or she had a touch with the door, and he thinks that there are some germs, there are some, this is, I am telling about the non-COVID situations, non-pandemic situation. That I have touched the door, and so many people touch this knob or handle, and these germs are spreading in my, has been spread in my hand. So I have to wash the hand regularly right now. So these are the thoughts of OCD patients. And if you act like OCD patient, just like an OCD patient, it will do some good for you, I think. So proper knowledge, proper personal protective equipment, and frequent hand washing, and proper use of the mask. And you don't have to, it is very much important to use the mask properly, that you are not allowed to leave the mask on a surface. You must have to hang it whenever you putting off your mask. And it is not ideal to put off your mask and then put on it again. You just keep your mask fixed, and whenever you return to your home, you will take the mask off. This is the ideal rules. Once you have put on your PPE or mask, you are not allowed to take it off. So these are the basic rules, and I think take more knowledge, and which will give you the confidence, and which will boost you up.
Okay, sir. Prasanna Raj Joshi. He has asked, sir, an interesting question. Sir, there is so much of free time, so at the same time, we aren't doing much of studies, thinking there is so much of time. So if suddenly the routines are published, how to deal with it?
I think that's a question everyone
That's what
really interesting question.
So I think that will be our last
yes.
question for today too.
Better to start than it is than not starting at all. So I think still some more times you have on your hand, and what has been past, we don't want to think about the past year. We want to think about the past things, bad things we do. We just want to move forward. So you just take your copy, take your book, and have a pencil, and just chalk out the plan. Yeah, how many days left, and what are the subjects I have to study, and what are the curriculum, and what are the syllabus I have to cover, and divide it into some sessions. And this is the only thing, only option, only and one and only option you have in your hand. So no, I think there is no option to look backward. The only option is looking forward, study, and pass the exam.
Thank you so much, sir. I think that was an answer what we already were dying to hear all this while, because this is a common problem faced by all, which like no one had answers to it. So thank you so much for covering that, as well as numerous topics, from common problems such as checking news often. Like I remember when COVID just struck Bangladesh, I was on my phone. We were actually calculating the number of people infected versus the death, and we were also constantly checking, until one time I think someone realized that it was not healthy. So maybe we had taken it in practice. You also covered the free-floating anxiety, the impending doom, the world is going to end, the conspiracy theory. I think you have you covered all the topics that are under this, sir. So thank you so much for taking your time out, sir. And I can't thank you enough for how patient you were, for how humbled and down to earth you are. So I really appreciate that about you. And also the session itself, I think though I won't have enough words to have praises for it, sir. Like you covered all the topics, all the questions that we had in mind. So we're really thankful for that, sir. And
so,
yeah,
sir, once again, actually, we're really grateful to have you among us for this amazing session. And sir has made all the slides like in this evening. I mean, he I don't know, sir, how you manage all these things. One thing I want to say that also we should recognize the sacrifices the healthcare workers are making. I mean, sir himself was a frontline fighter, and people seems like they don't recognize or respect them properly. Okay, so actually বলতে গেলে আমাদের সবাইকে এই জিনিসগুলো একটু খেয়াল রাখতে হয়, যারা হেলথ কেয়ার ওয়ার্কার আছেন, যারা ডক্টর আছেন, নার্স আছেন, সবাই কিন্তু মানুষের কাছ থেকে অন্য কিছু চায় না, শুধুমাত্র তাদের যে কষ্টটা বা তারা যে স্যাক্রিফাইসটা করছে তার জন্য যথাযথ একটা সম্মান, এতটুকুই কিন্তু সবাই চায়। সো উই হোপ দ্যাট along with maintaining the social distancing, we should not maintain the mental distancing. Thank you, everyone.
Well said, Pinky. I think on that note, we would like to end this session, sir. And we hope that, and I thank you on behalf of BMSS, on behalf of DMC LC, and we are more than privileged to have you as our facilitator, as our mentor, sir. And if there are any other problems, I think so we'll be welcoming all of you with open arms to answer their questions. And we would really hope that in the future programs, we will have you, sir, and we'll have your support, sir. So thank you so much.
Some appreciation comments, please. Sadia
Okay.
Nusrat Rimi said, thank you so much, sir, for being here today, and thanks to all the hosts. It was a really good session, very healing and smoothie. Then Priya Odhikari said, thank you so much, sir, for such a great presentation. Then Janisa said, in such unpredictable times, your insightful guidance is the best we could ask for. Really, it is. Thank you for helping us cope with all of it, sir. Forever grateful. Jahin Sharia said, thanks a lot, sir, for conducting such a nice presentation.
And I agree.
Thank you, everybody. Thank you. Thanks a lot. And my best wishes for everybody and for the BMSS and for DMC LC.
Thank you, sir. Thank you so much, sir. Okay, so with your permission, sir, I would like to close this session, and hopefully we'll be coming up with new programs and new ideas. So I hope you are tuned in with our page, and so it was a pleasure to have you on board, sir. Thank you so much once again.
Thank you, sir.
I'll end the meeting now. Sir, am I audible? Is it okay that I end the meeting now with your permission, sir?
Audible.
Okay.
Okay, so with your permission, we're ending the meeting now. Thank you, sir.
Okay.
Okay, sir. Thank you so much.
Live হয়েছে?
So we have the recording. So we have the recording. We will be posting it soon.
Live হলো না কেন?
So actually, the admin of the page were changed. So we had some technical difficulty with the Zoom itself. That's why, sir.
ঠিক আছে.
So sorry for the inconvenience, sir. So we tried with 2 different pages, but I think there was a problem with our Zoom account. So that's why.
Okay, no problem. ঠিক আছে.
Okay, thank you so much, sir.
Thank you.